Good afternoon or morning, depending on your time zone, and welcome to the webinar, Your ACA Questions Answered, What Restaurants Need to Do Now to Stay Profitable Under the Affordable Care Act. Today's webinar is hosted by Nation's Restaurant News and Restaurant Hospitality and is sponsored and presented by PeopleMatter. PeopleMatter is a provider of web-based talent management software and services for helping restaurant and retail organizations hire, train, onboard, and schedule employees. This afternoon's agenda will cover upcoming important dates related to the health care reform, the delay in employer mandate and what that means for 2014 and 2015, key rules to be aware of when you have parent subsidiary or brother-sister corporations, how the ACA pay-and-play penalties are actually calculated, how online software can help keep labor and benefit costs under control, and how the Affordable Care Act affects workforce management. Before we move into the presentation, let me explain how you, the audience, can get the most out of this event. And by the way, my name is Alan Little, and I am the Managing Editor of Special Projects for Nation's Restaurant News, and I am your moderator today. Before we move into the presentation, again, let me explain how you, the audience, can get the most out of this event. If you have any technical difficulties, please press the Help button on your player console to receive assistance in solving common issues. For audio or slide advancement problems, try hitting the F5 key on your keyboard to refresh your webinar console. Use the Command and R keys if you're on an Apple computer. You will notice a toolbar on the bottom of your console, and from working from there, you can open and close the widgets on your screen. For example, if you need to adjust your volume, click on the Media Player widget. When you're done, click on it again to hide the Media Player window. Feel free to customize your webcast console. You can move windows around by dragging on the title bar or resize your windows by clicking on the lower right corner of any window. We welcome your questions about the topic. To submit a question, simply type it into the question window on the lower left-hand side of your screen and hit the Submit button. We'll be answering as many of these questions as possible during the Q&A period that follows the main presentation and some moderated discussion among the panelists. But please feel free to send in your questions at any time. We'll add them to the queue. Please also be aware that today's session is being recorded and will be available at the Nation's Restaurant News website within the next week. You will be notified by email when the archive of this event has been posted. Now I'd like to introduce today's speakers. Yvonne Frame, Client Executive for the Marsh and McLennan Agency, and Nancy Sansom, Senior Vice President of Marketing for PeopleMatter. Yvonne Frame has been in the employee benefits consulting field for over 15 years. She holds both the Group Benefits Associate and the Certified Employee Benefits Specialist designations awarded jointly by the Wharton School and the International Foundation of Employee Benefit Plans. At Marsh & McLennan, Yvonne provides analysis and recommendations specific to the Affordable Care Act and plan financials for large companies. She has presented at numerous conferences specific to the service industry, including most recently the Restaurant Finance and Development Conference in Las Vegas and Bernstein Research's Equity Analyst Conference Call for Retail and Hospitality in New York. Nancy Sansom leads PeopleMatter's marketing team and has more than 15 years of experience guiding product strategy, management, and marketing in the software as a service industry. Prior to joining PeopleMatter, Nancy was the Senior Vice President of Product Design and Marketing at Benefit Focus. Nancy earned her MBA from Carnegie Mellon University and has participated in the Kellogg School of Management Executive Education Program. Now that we know about our presenters, let's hear what they have to say. Yvonne, please get us started.
Thanks, Alan, and thank you to everyone for joining us today. I'd like to spend a few moments reviewing where you should be in terms of implementing the Affordable Care Act, and then we'll focus on preparing for 2014 and now 2015. If you currently offer benefits, these in-place requirements should come as no surprise. One area I'd like to highlight is the annual notification requirements for grandfathered status. Don't forget about this requirement. Losing grandfathered status can trigger potential discrimination testing requirements for fully insured plans, in addition to other requirements for plan coverage benefits. For employers in the restaurant industry, adding additional benefits and being subject to discrimination testing requirements can be disastrous. While the discrimination testing rules are on hold for fully insured non-grandfathered plans, it is important to be cognizant of the potential consequences of having a discriminatory plan, which can be very costly. If you have not yet lost grandfathered status, don't forget to measure where you stand now and what would happen if you do lose your status, and please don't forget to notify your employees annually of your grandfathered status. One important side note, if you are self-funded, discrimination testing already applies to your plan, regardless of grandfathered status. I've also have on your screen what plans who do lose grandfathered status must also do, including 100% preventive care coverage, updated appeals process, and patient bill of rights, including out-of-network coverage for the emergency room. By now, most of you have gone through one open enrollment period in which you were required to distribute the summary of benefits and coverage. Don't forget, this must be distributed to all eligible employees upon initial eligibility and then at least annually, regardless of plan status. The SBC has been updated to begin using the new form in 2014 to include the minimum value statement. For employers with 250 or more W-2s issued in the prior tax year, and this is measured every year, don't forget to report the total value of the medical benefits on your W-2s. This value is employer and employee annual cost, or you can just use the COBRA premium minus 2%. 2014 is when the bulk of the law is ushered in, including the individual mandate. Health insurance marketplaces will be open to provide coverage, and the 90-day waiting period maximum is in effect. Restaurant employers need to be particularly cognizant of the 90-day waiting period. Benefits can no longer start first day of the month following 90 days. Benefits must begin on the 91st day. Otherwise, if you want benefits to start on the first day of the month, you are limited to no more than a 60-day waiting period. For employers with 200 or more full-time employees, auto-enrollment is expected to begin sometime in 2014. We're still waiting for guidance, but employers will need to be diligent in collecting waiver forms before the employee's eligibility period expires. As a reminder, all employees, regardless of part-time or full-time status, and regardless of benefits eligibility status, must receive their marketplace notice by October 1, 2013. The notice must be customized with employer contact information, eligibility rules, and minimum value and affordability status if you offer a health plan, even just to some employees. For all new employees who are hired on or after October 1, you must provide the notice automatically and free of charge within 14 days of date of hire. I recommend including the notice with the documents that all new hires receive. If you administer COBRA in-house, make sure your COBRA notice has been updated with the marketplace language too. Let's talk about the news released in July. The administration announced that the required reporting by employers on the value and cost of coverage, as well as who is covered, is delayed for 1 year. The first reports will now be due in 2016 for the 2015 calendar year. A request for comments was just issued on the proposed reporting requirements, including how to make the reporting least burdensome to employers. You have until November to submit comments. Because this information is needed to administer the employer mandate, enforcement of employer shared responsibility penalties, also known as a pay or play mandate, is also delayed until 2014. But what's not delayed? Well, other ACA provisions, including the marketplace and expanded Medicaid in some states, the individual mandate and marketplace subsidies, health insurer fees, as well as transitional reinsurance, the Patient-Centered Outcome Research Institute fees, the notice of coverage options through the marketplace notice, and your summary of benefits and coverage are all still moving forward with the 2014 effective date. It's important to review what your plan's priorities are and your strategies are to tackle 2014. Let's spend some time on the exchange concept. What is it? Well, the public marketplace is an alternative to employer-sponsored and individual policy private medical insurance. Think of it as Travelocity for health insurance. It must be fully operational by January 1, 2014, with enrollment occurring on October 1, 2013. Remember that notice you are distributing by October 1, it's to notify the employees of the availability of the marketplace. Less than half the states will operate their own exchange. And the Congressional Budget Office estimates that 25 million people will shop for coverage on the marketplace, and 19 million of those shoppers will be eligible for the Federal Premium Assistance Tax Credit, or the subsidy. Under the public marketplace, there are 4 benefit levels based on metal tier status, with the bronze plan covering 60% of services and the platinum plan covering 90%. A 5th plan, a catastrophic level, will be available only to individuals under age 30. There's also a new emerging platform, the private exchange model, such as the model offered through the Mercer Marketplace, which gives employers an opportunity to continue to sponsor a group benefits plan, but experiment with a defined contribution platform that helps employers retain budget control, particularly if they are expanding coverage to those not previously eligible for benefits. Under the private marketplace model, employers will select, similar to the public exchange, one of 4 to 5 plans, all with matching metal tier values from 60 to 90%. 27 states have defaulted to the federal marketplace. The good news for employers who operate in multiple states, you can still direct your employees to healthcare.gov. You don't have to direct them to state-specific exchange websites. If you've reviewed the marketplace notices that are due to be distributed by October 1, you'll note that that's exactly where the marketplace notice directs your employees to as well. Healthcare.gov will collect that information on residents from your employees and direct them to the state-specific exchange website. Let's move our focus to the employer mandate, now effective in 2015. There are 2 questions an employer must answer. Do I pay or do I play? You should determine now your liability under either scenario before 2015. In reviewing the financial impact reports we have provided our clients, well over 450, we have found that employers with a high number of variable hour employees will experience some of the most dramatic cost increases. By continuing their current strategies, hospitality and restaurant employers can expect to see increases of at least 60%, mostly due to penalties for not offering coverage to all eligible. The other option, a compliance strategy, one in which employers are offering benefits that are affordable and sufficient to employees who work 30 hours or more per week, does not fare much better, with an expected increase of over 25%. So what will be your penalties, and what will be the impact of expanding coverage to all full-time employees? And what are your strategies? As a reminder, the new full-time status in 2015 is 30 hours per week. So if you have to expand coverage to individuals who work 30 hours or more per week, what will be the financial impact of doing so? You can avoid the pay penalty if you offer coverage to at least 95% of your full-time population and their dependent children. The 5% window is welcome, as restaurant employers with the high number of variable hour employees will face a monumental challenge in tracking employee hours, which we will discuss later on. Does the mandate apply to you? If you have less than 50 full-time employees, but a high number of part-time employees, you need to aggregate the total number of hours worked by those part-timers and divide by 120. If that number plus your full-time count puts you over 50, the mandate applies. One side note is that under the original guidance we received, when the mandate was still in effect for 2014, employers could take their best 6 months in 2013 to determine their number of full-time equivalents. Beginning in 2014, they would have to use the full calendar year count for 2015. We're being conservative and are assuming that employers will use all of 2014 to determine status for 2015 until we receive further guidance. It is imperative you have a strategy in place now on how you will measure your variable hour employees. A variable hour employee is one that you cannot reasonably determine will work at least 30 hours a week or more upon data hire. So these will include your part-time employees and also your seasonal workers. Most employers will use a 12-month look-back period in which they can retrospectively measure the number of hours worked. If you are using a 12-month measurement period, you will need to start that period in the last part of 2013, assuming you will begin to comply with the mandate in 2015. Remember, you will need to have 2 measurement periods, one for ongoing employees and one for new hires. Nancy is going to spend time on solutions to tackle the variable hour tracking conundrum. Is it financially more tolerant to pay or to play? 41% of the plans we tested will see the largest increase in continuing their current strategy, which for many restaurant employers means falling into the pay category, in which benefits are not offered to at least 95% of employees working 30 hours or more per week. 25% of the employers we surveyed will have a penalty related to eligibility. So what will it cost you to play? And what must you take into consideration? How will auto-enrollment impact your plan cost? Will Medicaid be expanded in the states you operate in? And have you considered the impact on your full-time population? Let's look at control groups. Is it possible to split up your company into separate entities and avoid or minimize the penalties? Unfortunately, the answer is no. For purposes of the application of the mandate, the government will look at full-time equivalent numbers based off the total number in the entire controlled group. So if the entire control group has over 50 full-time equivalents, the pay or play rules will apply. What about how the pay penalty applies within a control group environment? Well, under this rule, the pay penalty will apply to each entity separately, except that the full-time credit that is given for the first 30 employees within an entity is split proportionately amongst the entire control group. As you can see, we have 63 total full-time employees split amongst 4 entities within a control group. Of the 30 exclusion for the credit under the pay penalty, it will be applied proportionately against the percentage of total number of full-time employees within each entity. As with single entities, the $3,000 pay penalty only applies to the number of individuals receiving the subsidy. Let's focus on pay or play strategies. If you decide to play, what strategies should you consider? If you decide to pay, will you just cancel benefits and not make a pay adjustment? Or will you make a pay adjustment to keep employees whole, or at least to provide some assistance in purchasing coverage on the exchange or through the private individual market? Let's look at what employers are planning on doing. 32% will do active workforce management so that fewer employees will work more than 30 hours per week. Others will consider a value plan to offer employees who work under 40 hours per week, and we'll spend time talking about both those strategies. Key strategies that restaurant employers will focus on do include managing workforce hours. So looking at those individuals who maybe work 30 hours, 31 hours, 32 hours, and reducing those hours to just under 30 hours through workforce management. Value plans have taken on a new meaning recently. Many employers are looking at offering a 60% value plan, which is the minimum value requirement to meet the sufficiency rules, and they'll position that plan as the base option, with the current plan that may be available to just managerial staff as a buy-up option, but now available to all employees who work 30 hours or more per week. There's also a new thought on offering a minimum essential coverage plan, which many of you have heard of, referred to as a skinny plan. One word of caution: while offering a skinny plan or a minimum essential coverage plan may avoid the larger pay penalty for not offering minimum essential coverage to all full-time individuals, it will not necessarily help you avoid the pay penalty for not offering coverage that meets the minimum value requirement of 60% sufficiency. We recommend, if you will offer a minimum essential coverage plan, that you still also offer a minimum value plan that meets the affordability guidelines. As a reminder, a plan is deemed affordable if it does not exceed 9.5% of an individual's income for single coverage. You can safe harbor the affordability by capping the single level premium at 9.5% of federal poverty level, or roughly $92 a month. Remember, the delay to 2015 only highlights the complexity of the law. While it allows employers more time, it does not mean it's more time to do nothing. It's important to develop strategies now, including monitoring your employees that are expected to work less than 30 hours per week, resetting the status for some full-time employees to no more than 30 hours per week, and creating additional classes for employees working between 30 and current full-time equivalent level that are under full-time health care only. It's important to develop those strategies now, and with that, I'll turn the presentation over to Nancy to discuss workforce strategies in more detail.
Okay, thank you, Yvonne. Well, it certainly is a complex and continuously evolving topic. In my segment, I'm going to focus on how the Affordable Care Act impacts the way you manage your workforce. There are many new complexities to consider, but technology can help. So let's look back at one of Yvonne's slides about how employers are likely to handle the 30-hour per week threshold for offering benefits. According to the Mercer survey, 32% of employers will change their workforce strategy so that fewer employees work more than 30 hours a week. That means more part-time workers. How many more? Well, let's look at an example. If a restaurant owner currently has 300 employees who work on average 40 hours a week, that's 12,000 hours per week. Now, if that restaurant owner limits his employees to 29 hours per week, then to fulfill that same 12,000 hours each week, he's going to need 414 employees rather than 300. And that's an increase of about 38% in the number of people that this owner needs to hire, train, and schedule. So let's break that down a little bit and talk about what that means. So that means 38% more hiring. So you've got to find and evaluate a lot more people. You've got to conduct more interviews and more background checks. And you've got to onboard them too. So that means more I-9 paperwork, more tax credit paperwork, more orientation sessions, and all the other tasks associated with new hires. According to a survey of the PeopleMatter Institute, the average manager spends more than half of a 50-hour work week on hiring-related tasks. And many of the companies that we talk to are still managing these processes with paper, and their processes aren't robust enough to handle the additional complexity and volume that's coming due to the increase in the part-time workforce. We're also hearing from our customers that employee turnover will be higher with the part-timers. And this means that 38% number that we calculated a moment ago might be even higher, because your part-time employees will be more likely to leave if they can get more hours elsewhere, which means you'll be hiring and onboarding even more employees. So the cost of replacing an hourly worker in the restaurant industry certainly varies depending on the segment, but it tends to be between $1,000 per employee and $2,500 per employee. In summary, with a higher percentage of your workforce part-time, you'll have more hiring and more onboarding, but since you're likely to have higher turnover as well, that's going to lead to even more hiring and onboarding as well as higher costs. PeopleMatter provides a technology platform that is specifically designed for these challenges faced by restaurants and hospitality companies with a large number of hourly workers in a service-oriented environment. The PeopleMatter platform has 3 modules: Hire, Learn, and Schedule. With PeopleMatter Hire, we automate the application and hiring processes, including background checks, behavioral assessment testing, I-9 verification, and onboarding. So let's go ahead and take a look at a demonstration. All right, so what you're looking at here is the Facebook page for one of our PeopleMatter customers, the Palm Restaurant. If you're lucky you've been there, it's an amazing experience. And basically what we've done is let me go back to their main Facebook page. So this is their main Facebook page, and you'll see this little Join Our Team button here, and that is a PeopleMatter Facebook app. It's an extension of our PeopleMatter Hire module. And so what we do is we let our customers, like the Palm, leverage their fan base on Facebook to promote their job offerings. So let me go ahead and type in a location here. Let's pull up all the locations in New York City. So they have several locations in New York City, and I could click on them on the map over here. And I can see what the openings are at those locations. And if I'm a team member or maybe just a fan of the Palm, I can like and share any of these jobs and just help the Palm promote these jobs that are open. I can also see more information about these jobs by clicking on See More Info. And I can look at the specific requirements of that job. And also, again, I can share the specific information about that job. Now, when I'm ready to apply to a job, I just click on Apply for this position. And what that does is it takes the candidate right into the PeopleMatter application process for the Palm. And you'll notice in the middle here it actually says you're applying for the position of bartender at the Tribeca Palm. And the application experience is extremely simple for candidates. You know, they just kind of walk through a one thought per screen experience. It's available in Spanish and English, and it's really very straightforward. So let me jump over to another screen. Hang on just a second. All right, so now what I'm going to do is show you what it looks like if I'm actually the hiring manager and I need to find some applicants. I need to make some hires. So this is what it looks like if I'm the hiring manager. And, you know, I mentioned PeopleMatter platform has Hire, Learn, and Schedule. So those are the tabs across the top, and I have a news feed in the middle and several hot links here. But let's just jump into Hire. So inside of Hire, you'll see that I have applicants on the left, candidates in the middle, and team members on the right. Well, I need to hire some people. So I'm going to click on Applicants, and I'm going to show you how PeopleMatter helps with this, you know, additional volume of applications that you're going to get moving forward. So what we're looking at is a list of 18 applicants, and I can see some information very quickly about them. I can see whether they have passed the behavioral assessment and also whether they pre-qualify for tax credits or not. So that's what these icons on the right are. But I want to filter this list of 18 applicants because I don't have time to look through all of them. So what I'm going to do is I'm going to filter the applicants by location. Everything that PeopleMatter does assumes that there may be multiple locations, which means we support transfers across locations and scheduling across locations and all of that. I also might be looking for a specific position, so I can filter this list by position. Availability, so whatever shifts you have would show up here, and you could filter by availability. Maybe I'm looking specifically to fill the morning shift, and so that narrowed me down a little bit. It took out 3 candidates who weren't available in the morning shift. And then I come in and I want to see just the people who have been recommended via the assessment. And so you can see those people here. I could also filter based upon people who have passed the tax credit pre-screening process as well. And that's important because on average, these tax credits can be worth $1,300 per new hire that qualifies. So that can be a pretty big deal. So what I'm going to do is just show you real quick what it looks like if I pull up a particular candidate. So what we provide to the hiring manager is one view of that candidate that shows me where he's applied. And so in this case, Brock Landers has applied in 3 locations. I can take a look at his assessment results. And this is pretty cool because it shows me where Brock lands on all these bell curves. So where he is represented by the red star there. And I can see if he's in the red, yellow, or green on all these different categories like tough-mindedness, his ability to follow rules, how extroverted is he. And the cool thing is I get an overall score for Brock at the end telling me his overall fit with this job. So that's pretty cool. And across the top you'll see, I can access all of his application information, his references, any notes about Brock, background checks, and other documents like resumes, and anything else would be attached right here. So you can see we're having an online platform that will really help manage the hire applicant flow. We talked about onboarding earlier, so let me jump in and just give you a quick idea of how PeopleMatter helps with the I-9 process. So our goal is to remove all the guesswork from I-9, and so during onboarding, first we'd ask the new team member to fill out the information, and we'd only present that team member with the information he needs to fill out. And then we'll help your hiring managers manage the due dates around completing the I-9. We'll tell them when something's overdue and whether we're waiting on the employee or the employer. And when it's time for the employer to do the segment of the form for the employer, I'll show you what that looks like. So we just make it real simple. So we kind of walk you through a 4-step process. You pick which document is going to be used. And we'll error check all this and make sure that you're capturing all the information that you need to capture for the I-9. So it's a pretty straightforward 4-step process once the employee's done their portion. PeopleMatter is an authorized employer agent of the Department of Homeland Security, and so we can verify your employees instantly with E-Verify without having to deal with any actual paperwork. So that's really great. So I'm going to click back on Manage Team Members and show you a little bit more about onboarding. So if I pull up Alex here, what you'll see on onboarding, I'll click on the onboarding tab, is that we can have tasks, or basically a to-do list that's developed just for your company on what does the manager need to do for onboarding, and so you can see some things the manager needs to do here, and what does the team member need to do. And you can provide as much detail on this as you want. You can add notes, send email reminders to the team member, and that kind of thing. And you'll notice there's a section for company items and King Street items. And what that is that's just a way for the company to have some standard things that need to happen in onboarding, and for locations to have their own specific kind of punch list as well. So that's onboarding. So let me go back into the presentation, and we'll continue here. Hang on just a second. All right, so back into the presentation now. We'll do one more demo here in just a couple minutes. So we've talked about hiring and onboarding. What other impacts would there be to your business with a larger part-time workforce? Well, you'll have more people to train on an ongoing basis for things like process changes, menu changes, just anything that's changing with the business on an ongoing basis. Now, we've also heard from companies that part-timers are more challenging to train. Since they are more likely to work multiple jobs, they need to absorb everything that you're teaching them, but they have fewer hours to absorb it all, and they have to kind of keep all that information straight, along with remembering the ins and outs of their other job. So that certainly adds some complexity. Now, with PeopleMatter Learn, employees can receive ongoing training online at any time. And managers can assess the results of the training by creating quick online tests. So what you see on the slide here is an example from Mad Greens, and this is an online customer service test that they created. Mad Greens is an awesome fast casual concept out of Denver, Colorado. And our goal is to have managers be able to post information and create tests within about 10-15 minutes. And these tests help to validate that a team member has actually absorbed the training materials. So let's talk about the impact of the larger part-time workforce on scheduling. So scheduling complexity increases dramatically with more part-time workers. And also we're going to have to keep track of that 30-hour threshold, and we'll show that in just a moment. So since there are more people, there's obviously going to be more time off requests, more shift changes, and more people to put on the schedule and notify of any changes. But there's also complexities with worker availability. So if your team members are working multiple jobs, then you need to schedule around when they're working somewhere else, and surely the schedules will be published at different times, and there'll be different scheduling policies in place at the different companies. So this adds a lot of complexity. Now, many of the companies that we talk to are still scheduling with pen, paper, or Excel, and they post the schedule somewhere, and team members have to physically examine it. And time off requests and availability changes are managed via, Post-it notes. Shift swaps require multiple phone calls, and there's just a lot of hassle related to scheduling. So with PeopleMatter Schedule, employees can get their schedules on their phones. And so what you're seeing here is the PeopleMatter app, which is a free app, and employees can pull it up at any time and see the schedules that have been posted, who they're working with, and make requests and requests for changes or time off. So the second screen is showing time off requests. And then managers can approve time off requests and shift swaps right from their phone because they tend to be running around. And they can also view the shift's roster, which is what you see in that third screenshot. And they can push out communications and reminders to team members as well. So that's quite different than the old post the schedule in the back approach. So let's look back at one of Yvonne's slides. So moving forward, companies will need to monitor employees that are expected to work less than 30 hours a week. So how can they be sure that employees who are supposed to stay part-time are indeed working less than 30 hours a week? Remember this concept of the look-back period that Yvonne was talking about? So companies are typically more inclined to use a 12-month look-back period if they have a lot of seasonality in their business. So that would mean that you would need to start measuring and managing to that 30-hour threshold soon, since the number of hours worked during the look-back period will determine whether a worker is considered full-time and therefore eligible for benefits starting in January of 2015. So let's take a look at another demonstration. So I'm going to switch back over to the demo here, and we will go into the scheduling area. So we looked at hire, and we saw a little bit about learn. So now we're into the scheduling area, and let's say I'm responsible for creating and managing schedules for this company. So I can see some, quick items on the left, and we'll talk about that in a moment. But let's go ahead and pull up a schedule for one of these locations. So if I'm a regional manager, I might have access to multiple locations, but let's look at King Street. So with the schedule, I can see what location I'm on at the top. And just to kind of orient you guys to what you're looking at, I can jump to a particular week of the schedule. I can also look at a schedule in a week type of view or a day view, and I can use these arrows to kind of jump around. I can also look at a schedule by department or by particular job. So you might have someone who's just responsible for scheduling the hostesses, or maybe just the servers, or back of house, front of house, so you can organize your scheduling that way. All right, so what are we looking at here? So we can see the people who are scheduled for various shifts. If everything's cool, they're in blue. If there's any kind of issue, like with Lane here, you'll see that she's in red. And so let's talk about that. So Lane Foster is someone that we identified as a part-time worker who needs to stay under the 30-hour threshold. And so what happened was somehow she got scheduled for more than 30 hours. And what's kind of neat about PeopleMatter, I mentioned multi-location earlier, we can see that she's actually, we're looking at the King Street schedule, but we can see she's scheduled at West Ashley. because of the shaded lines here. And if I roll over it, I'll see, oh, okay, well, Lane's scheduled somewhere else, and now she's over 30 hours. So let me edit her. And what I can do is just simply do a cut and paste that shift down and give it to Mark here. And Mark isn't supposed to be under 30 hours, so that works great. I can go ahead and publish that change, and then everybody gets that notification on their phone. And we're done. It's that simple. So Lane is no longer in the red. And let's see, if we scroll down a little bit more, we'll see that Tracy is in the red. And so we could make similar changes with her. Troy is red because he's working more than 40 hours a week, so he doesn't have to be part-time, but we're also trying to manage overtime and keep our labor costs in check. So I wanted to show you what it looks like if I put someone into that condition where they're going to be working more than one of these thresholds. So Amanda is someone who's supposed to stay part-time. And so right now she's at 24 hours, so that's fine. But let's say that I came in and scheduled her for more than 30 hours. I can give her a particular task here and save that. Okay, this is what it looks like. It says, well, you violated your Affordable Care Act threshold. And so I can see that quite clearly. And I could decide, well, I'm going to go ahead with that. And then she turns red, and we'll continue to notify the scheduler every time she goes to publish that we've got that issue. So she's right at 30 hours. And actually, in this case, I set the threshold at 29, just to be on the safe side. So I might say, well, I'm actually okay with 30, and publish it anyway. And so that's kind of how those thresholds work. You get all kinds of notifications, both at the time that you do it and when you publish. And I wanted to show you real quick how someone gets that threshold applied to them. So if I jump back into Hire, pull up this candidate here, Ben Long. When I go to hire Ben, so he's been interviewed, let's say we're ready to hire him, that's the point where I get to say whether I want one of those thresholds to apply. So down here at the bottom, there's an overtime and an ACA threshold. So I might just want to manage overtime with Ben, or I might want to manage to that Affordable Care Act threshold as well. So that's how we know whether employees are going to be subject to the threshold or not. Now, as far as managing on an ongoing basis, because really you're trying to make sure these employees over time are working less than 30 hours, so you might be okay with them occasionally working more as long as they're also working less. You can manage this on an ongoing basis right here on this screen by saying, okay, let me see who all is working more than 30 hours, which is my ACA threshold. And I can take a look at their schedule and quickly jump over and fix it. And just kind of, it's just another tool to help me manage that threshold. And you might be asking yourself, well, what if this 30-hour threshold changes? And so I'm going to jump over into the settings area for a minute and we'll talk about that. So as you may know, the NRA is lobbying for 35 hours or maybe 40 hours. And, right now it's at 30, but that could change. And so at PeopleMatter, we made it a configurable threshold. So if that changes, you could come in and say, well, my threshold is now 35 or 40. Or it's 35, but I want to manage it to 34 to be on the safe side. So we heard from our customers that they're going to all kind of manage this ACA threshold in different ways, and so we just made it real flexible for them. All right, so that's the conclusion of the demo. Let's go back and just summarize here before we jump into Q&A. So in closing, if you're like most companies, managing your workforce is already pretty challenging, and since many companies are increasing their part-time workforce, those challenges will only become greater. So using technology like the PeopleMatter platform will help you manage these challenges, including that 30-hour benefits threshold, and will help you not only manage these changes, but also make dramatic improvements in your hiring, training, onboarding, and scheduling practices. So with that, let's turn it over to Alan for the Q&A.
Thank you, Nancy and Yvonne, for sharing all that information. That was quite a bit to take in. The good news is there's some backup and support on that when you want to look at it again, and also when the event is posted at NRN and at PeopleMatter. A few of you have already submitted some questions, so we're going to jump right into that. And also, we would like to thank you for the great questions you submitted when you registered for this event. Now, while our presenters are answering your questions and that have come in and that are coming in right now, we'd like to ask you to take a minute to complete our exit survey. You do that by simply clicking on the red survey widget located on the toolbar at the bottom of your console. So we appreciate your participation there. That information is always good for us to have, and thank you for that in advance. Well, one of the first questions that came in, and one of the questions we have up first, is from an audience member who says, in our situation, our benefits renew on December 1st of this year. How does that work if someone chooses to go to the exchange but is covered already? Can they drop out of the employer coverage? Is the exchange considered a qualifying event? So Yvonne, what can you tell us about that?
Ellen, that's a great question, and one we've gotten quite a bit recently on fiscal year plans. The good news is, in January 2013, the IRS published their latest ACA proposed rule regarding just this issue. There are instructions included in that rule for employers whose benefit plans operate on a fiscal year. And to help those employees who participate in fiscal year plans for cafeteria plans, the Treasury Department and the IRS will allow a one-time transition period. So this is for January 1, 2014 only, whereby participants may change from employer-sponsored health insurance coverage to a state or federal exchange plan for applicable large employers who operate a fiscal year plan. So in this case, December 1. So as long as the plan document is amended, then this would qualify.
Great. Thank you for that, Yvonne. Another question comes in, and it says, 50 people at one point in time or 50 people per year?
So the guidance states for application of the employer mandate, originally for 2014, employers were to use the best consecutive 6-month period in 2013 to determine if they averaged 50 or more full-time equivalents. For 2015, employers are advised to use the entire 2014 calendar year average. We assume with the delay that employers will still use that full calendar year average for 2014 since there's now time to measure the full year.
Thank you. Another question, does affordability apply only to the premium for the employee, or does it apply to employee 1, employee children, or family coverage?
The good news is the regulations state that the affordability is only measured for the lowest cost plan that meets the 60% minimum value requirement for the single tier only. Employers do not need to measure affordability for any dependent tiers, and there is absolutely no requirement that employers even contribute towards a dependent level of coverage.
Great. Thanks for that explanation. I'm sure that's going to make some people breathe a sigh of relief. Another question, can an employer offer different levels of health care plans?
Absolutely. Many employers currently offer multiple plans, and this trend will only continue. Employers are going to look to minimum value plans, so setting that base plan at a 60% level to set their contribution levels, and will allow employees to buy up to a richer plan. Again, the key to avoiding the play penalty is to make sure that your plans meet the minimum value standards of at least 60%. In addition, many employers are considering offering different levels to different classes of employees. Just be cognizant that doing so may trigger discrimination penalties, particularly if you are self-funded right now.
Thank you. Another question, how do I notify the employees at the October 1st deadline?
Very pressing deadline coming up here. So under the marketplace requirements, employers are required to notify employees of the marketplace, including the availability of any subsidies as well as eligibility rules for employer plans no later than October 1 for existing employees. The Department of Labor has posted 2 model notices which are available on the DOL's website, and you will choose a notice based off your situation. So if you offer coverage to some or all employees, there is a notice for that. If you do not offer a group plan at all, there is a separate notice for that situation. The notice has to be in writing, and it can be distributed via first-class mail. It can be distributed electronically, provided that you follow the DOL's safe harbor rules. It can also be attached to paychecks, hand-delivered, or placed in a new hire packet. The key is that the employee has to get the notice. So attaching it to a new hire packet will work for new hires, but what about existing employees? So it's really important that you come up with a way to get it into every employee's hand and one that will ensure it gets to every employee.
Yvonne, is it a possible idea that they would have people sign on that particular pay period when they pick up their checks, or are you recommending any sort of backstopping, sign-off sort of process for that?
You know, that's actually a great idea and one that we have recommended to employers. Unfortunately, you know, the DOL has not come out yet and said, well, here are the penalties for noncompliance. Under the Fair Labor Standard Act, we know that the DOL has the authority to assess penalties. So for employers, it's really a good idea to make sure that they have some sort of verification that the notice has been received, whether it's signing off on a receipt of a paycheck, signing off for new hires when they get their onboarding packet, or if an employer does send it via electronic methods such as email, that they have a return receipt function as well.
Great, thank you. I have a question here that says, does the letter need to be in Spanish since it needs to be read by the average employee? And I guess that's presuming there are some Spanish employees. So what about the multilingual letters?
Well, that's a great question, and the DOL has actually provided the model notice in Spanish. Now, the model notice that's in Spanish is a PDF, and it's not one that you can actually personalize unless you handwrite it. So our recommendation is to make sure that this Spanish notice is at least attached to a copy of the notice in English for those Spanish-speaking employees.
Great, thank you. I have a question here for Nancy. Nancy, a question comes in, will your scheduling function limit employees to set hourly limits, i.e. less than 30?
Yeah, absolutely. And so there's a couple ways we can set hourly limits, and I wasn't sure which direction this person was going, but the one way is just the actual number of hours scheduled on the schedule, but another way we didn't really talk about is also the actual pay rate per hour. As you hire someone based on the job and skill level of the employee, you can also kind of have limits on the cost per hour that you're offering to that person during the hiring process, and then also on the schedule we can limit the hours. And, you know, I use the example of 29 and 40, but it can really be anything.
Great, thank you. Another question comes in, what if you have two plans, one a carve-out for management and one for all other employees? Do we use two separate notices or one? Yvonne?
You'll actually use one notice. You'll use the model notice for employers who offer a plan to all or some employees. And depending on who you offer the plan to, so if it's just a management carve-out, then you will note that in the eligibility rules as to who is actually eligible for the plan.
Great, thank you. Another question, does the marketplace notice requirement include all employees or just over 50 FTE employers?
It is all employers must notify all employees. That's part-time, full-time, benefits eligible, benefits ineligible, any active employee. It does not have to go to COBRA participants. It does not have to go to retirees. It does not have to go to dependents.
Great, thank you. Since the mandate does not go into effect until 2015, how do we fill out notices on October 1st when only management is entitled to insurance currently?
Well, the good news is about the marketplace notice is it is not being used as a method for employer reporting. It's simply a method for notifying employees of the availability of the marketplace and what their options are, including any options for the employer. So regardless of whether you offer benefits now to all employees or some employees, you still at least have to notify employees of where they can get information about the marketplace. And that even means if you don't know what you're doing for 2015. There's actually a section on the marketplace notice that asks what you're doing in the next couple of months. So if you are January 1, it's asking you if you've got a new plan year coming up. Well, a lot of employers haven't started their renewal period yet. So for that, in that case, you won't know what your rates are going to look like in 2 months. You won't know what your your employee contributions will look like in 2 months. So the good news is those questions are optional. The only required questions that employers have to complete on the notice are the employer contact information, the eligibility rules, and attesting to minimum value and affordability of the plans that you offer.
Great. Thanks for that summary. Question here I'm sure will attract a lot of attention among our listeners. And someone asks, tax credits for employees. Can you talk about this topic? Yvonne, what can you tell us about tax credits and how to work?
Well, I'm assuming we're talking about the subsidies. So an employee is, or an individual, regardless if they're employed or not, is only eligible for a subsidy to purchase coverage on the exchange if really 3 conditions are met. They earn less, they have a household income of under 4 times federal poverty level, which for an individual is expected to be about $44,000 to $45,000. For a family of 4, you're looking at about $95,000 a year. They are, if they're employed, they are not offered coverage by their employer. And 3, if they are employed and they are offered coverage, the coverage is neither affordable nor sufficient. So those are the only 3 conditions in which an individual can receive a subsidy under the marketplace. So if you are offering coverage to all individuals, or at least 95% of individuals who work 30 hours or more per week and your coverage is sufficient and it's affordable, that employee is ineligible for a subsidy. Your part-time employees, though, may very well still be eligible for a subsidy if you don't offer coverage. Of course, we see that in the news all the time. One other thing to mention, though, is you may not offer coverage to a full-time employee, but that does not necessarily mean that your full-time employee is eligible for subsidized coverage. If coverage is available to their spouse and that spouse's coverage is also deemed affordable and sufficient, then that could exclude them from subsidy eligibility because, again, your only requirement is to the employee level of coverage.
Great, thank you. One of our audience members says, we have been told this week that you cannot hand-deliver a notice and you cannot include it in a new hire packet. Yvonne, is there some special situation that might be at play here, or is there the definitive source that they can turn to that you can recommend?
Not that I'm aware of. The guidance that we received was from the Department of Labor, announced through the National Association of Insurance Commissioners, that specifically address the hand-deliver notice issue as well as the new hire packet. The key is that the employer has to ensure that it actually gets into the employee's hands. So, Alan, to your point earlier about getting a sign-off, attaching it to a paycheck, that certainly would meet the obligations for the employer to deliver that information. And that DOL guidance was actually issued about 2 weeks ago. It was issued on clarification about the hand delivering.
Great, thank you. So as always, you've heard some good information here and some thoughts about where it came from, but you need to always do your due diligence and check up for yourself. But there's some thoughts and some resources you might check on. Another audience participant says, I was considering covering the managers in 2014 and not the employees. Is that allowed in today's regulations?
Absolutely. With the delay in the mandate, employers will not be subject to any penalties until the 2015 year. So you can continue to exclude non-managerial staff who work 30 hours or more per week into 2014. You certainly can do that going forward. Just, of course, in 2015 is when the risk of penalties begin to apply.
Great. Thank you. Question. Most employees are high school kids. What do we need to do to make sure we do it right? 3 businesses with a total of 75 employees.
Well, if they are, for the employees who are working 30 hours or more per week, I mean, certainly you'll need to measure your full-time equivalent status. And it sounds like if you've got at least 75 employees, you probably would be over that 50 full-time employee threshold. The key, though, is to look at your population and to do a payer play analysis to see if you've got employees who are averaging 30 hours or more per week the number of employees who are averaging 30 hours or more per week, and then your obligations, of course, if you choose not to offer coverage, regardless if they're high school kids or not. I mean, generally speaking, you're going to start offering coverage typically when they're 18 plus, and only, of course, because at that point they probably are working 30 hours or more per week regularly. So I would certainly go back and look at your full-time equivalent count first, and then I would, if you are over 50 full-time equivalents, then focusing on your full-time employees, figure out if the pay or play strategy, which one would apply to you, and what your potential penalties are.
Great, thank you, Yvonne. One last question. We're going to make it quick, and then we're going to sign off. We're at about our time. What if you have employees in more than one state? Does that complicate things, Yvonne?
Yes and no. Two things. One, of course, with the availability of the exchanges, again, the good thing is that healthcare.gov will take care of directing employees to their particular state exchange. But the other issue has to do more with Medicaid availability. Each state, under the Supreme Court ruling, can opt out of Medicaid expansion. So depending on what states you operate in, you may find yourself with some individuals who are qualified for Medicaid under the expanded income guidelines. That could definitely be a benefit to your plan, because if they are eligible for Medicaid, they can come off of your plan, thereby saving you plan costs. If they're ineligible for Medicaid, though, they will probably remain on your plan if they're eligible and they're covered right now. So it's a little bit twofold depending on if you're looking at the exchange or if you're looking at Medicaid. But as always, if you operate a multi-state plan, just from an insurance perspective, if you're fully insured, just be aware of individual state mandate requirements as well.
Great. Thank you very much, Yvonne. Well, we're out of time, and I took us over a little bit, and I apologize for that. I'd like to take a moment to thank our presenters, Yvonne Frame and Nancy Sansom, for their presentations, and our sponsor, PeopleMatter, for making this event possible. If we did not get to your questions, they can be handled offline. Nancy, would you just talk about that briefly, about what might happen with the questions we did not get to today?
Absolutely. So we had a ton of questions. Thank you guys so much. We are going to answer those on the PeopleMatter blog. So you'll find that at peoplematter.com/blog, and it'll probably take a few days for us to, get all of that information consolidated and boiled down. But thanks again for submitting your questions, and you can check there in a few days.
And remember, again, this will be posted, and you'll receive a notice when this event has been archived. I would also like to thank you, our audience, for your time and attendance this morning and this afternoon, and for the great questions. We hope you found this presentation valuable and return for future webinars. Have a very good rest of the day. Thank you.